Sioux Empire United Way meets needs within our community by funding more than 80 different services. We help children, vulnerable adults, and people in crisis through a variety of services. Good happens across our community every day through United Way funded programs, and that is especially true now as our community handles the impact of COVID-19. Joining us today is Rebecca Wimmer, Executive Director for the Boys and Girls Clubs of the Sioux Empire. Thank you for joining us today, Rebecca.
Good morning.
Good morning. So why don't you tell us a little bit about the Boys and Girls Clubs for those who don't know that much about you?
Sure. Boys and Girls Clubs is an area nonprofit, and we are serving children birth through age 18 in early childhood and school age programs. The mission of our organization is to nurture, educate, and enrich children and youth for lifelong success.
And that's so important because South Dakota, 82% of families with children under 18 have parents in the workforce. How many people do you serve on average annually?
We serve about 1,500 children and youth annually through Boys and Girls Clubs programs. That's in our early learning programs and then also all of our school-based programs. Our organization has grown significantly over the last several years. One of the ways that we're seeking to reach more children is to really partner collaboratively with other organizations, be creative in what we're doing with programs, and really figure out ways to reach more children and youth in our community.
What types of adjustments have you had to make to your services in response to COVID-19?
Our services definitely look a lot different than we normally do. We have several school age programs that function out of school. So since schools are not in session, those programs are also not functioning. So we really had to adapt and shift our programs to still meet the needs of children and families, but do that in a different capacity. So we currently have 3 of our main locations that are still operating for early learning and then school age programming. So still providing all of that care for those kids. Obviously, it looks a lot different. So making sure that we're following social distancing guidelines, that we're keeping children in groups of no more than 10. All of their activities take place in their classrooms, which is a lot different than what they're used to. So no going to the cafeteria for meals, no gym time. We really are restricting children to the classrooms or getting some fresh air outside. We're also taking temperatures of staff and children 3 times throughout the day. So everything that we do looks completely different right now. However, still providing the same type of support, education, and nurture that our kids need to be successful. We have also added a number of programs to our organization. One of those is a collaborative program that has been extremely successful and also very important, I think, in our community. That collaborative program was a combination of the health systems in Sioux Falls, the school districts, several area nonprofits, the city of Sioux Falls, looking at providing care for essential care workers in our community, especially those that are on the front lines. Our healthcare workers, those that are doing dependent care, first responders. Many of those children are displaced. Either their child care centers are closed, the schools are closed, and families now try to find alternative care. So by putting this collaborative group together, we're able to have a centralized intake where families can contact us, and then we can help place those children in different agencies throughout the community. That's been very successful. The responses that we're getting from parents, I literally have had numerous parents, in tears saying, I don't know what I would do if you guys didn't have something like this. I'm a doctor, I'm a nurse, I need to go to work, but there's no place for my kids to go. So that's been exciting. Along those same lines, as we're talking to families, one of the biggest things we're seeing is that financial need. Just kind of even for those school age families alone, you think about the impact that school closure has had on them. And those families who normally maybe don't have a child care expense because the kids are in school all day are now looking at an additional $140 a week for those children to have care. And so for one child alone, that's over $400 a month. Many of them have 2 or 3 children that they're trying to provide care for. And so we've set up a scholarship fund. United Way has been part of that. We've been able to request reallocation of the dollars that are normally going to our programs that aren't running right now and move those funds into a scholarship program so that our kids can continue to attend. People in the community that can't afford care for their kids are able to tap into those scholarship dollars. And then just families that are struggling right now, maybe their hours are reduced at work and so they can't afford that childcare fee like they normally would, are able to use those scholarship dollars. We've received some additional support from some other agencies, as well as some individual donors to go towards that scholarship. So that's just been a tremendous support, and very grateful to United Way for the ability to really shift those dollars and still meet a need in our community. In the same way, we've also started meal service. That is also a partnership that we have done with Food for Sioux Empire Kids and Hungry Hearts, and we're serving over 6,000 snacks and evening meals a week and delivering those out to homes. So just trying to continue to meet the needs of our community, just in a much different way than what we normally look like.
Mm-hmm. Yes, you guys are very busy.
It has been very busy, but also extremely rewarding.
Good, good. So people are practicing social distancing, but still looking for ways to help in their community. What are a few things that people can do to help you?
Absolutely. So because we've had to change our protocols quite a bit, things that we could utilize in our programs is things like used games, toys, different types of equipment, things that we would normally be able to share between classrooms, such as board games. We can't share between classrooms anymore because we're trying to limit that spread. And so if you're cleaning out your closets, you're at home and you've got, lots of time on your hands and you've got some extra toys or games that you're not sure what to do with, definitely would love to have those donated. We do have boxes at each one of our agencies that you can donate toys, games, supplies. Obviously what we're doing looks very different, and so needing those supplies like gloves, sanitizer, things like that are a little more difficult to get your hands on. And so if people have those things that they'd like to donate, that would be fantastic. And then also encouraging cards, gifts, things like that to staff members. I cannot say enough about the staff that they're putting themselves out there every single week. A lot of the children that we're taking care of are children of essential care workers. And so we know that that risk is a lot different than what it normally looks like maybe for our families. But our staff show up every day and they show up to take care of those kids. They're reaching out to our kids, the ones that aren't attending, and we're doing some virtual programming. They're finding different ways to connect with their kids, whether it's a phone call to say, hey, how's it going? What do you need? And so I just am so incredibly proud of the way that our staff have been able to shift and really continue to meet the needs. So just dropping them a note and saying, you're appreciated, we understand the impact that you're making, is also, a great way to thank them for the work that they're doing.
Absolutely. Absolutely. What is one thing you would want people to know about Boys and Girls Club as our community continues to move forward?
Sure. So Boys and Girls Club has been around since 1957, and it has definitely adapted in many ways to meet those community needs. But since 1957, our mission has never wavered. The goal for us to provide a place where kids are safe, they get an education, that they have a place where they feel belonging, and they learn skills to be successful, that has never wavered, and that is still same today. COVID-19 has definitely changed what we look like. It's not our normal programming, but our mission has never changed. And that's one thing that I want our community to know is that we will continue to be here for our community and adapt in whatever ways possible to make sure that their needs are being met.
Awesome. Okay, so I have one final question. How are you personally dealing with the adjustments to social distancing while working?
Social distancing is a lot harder than I thought it was going to be. I typically consider myself more of an introvert, so I thought I would like social distancing, but I discovered I do like people, so that's good. I do enjoy when I do get to come to the office and visit with our staff and hear about the things that are going on in our programs. The other thing that has been kind of enjoyable about the social distancing or staying at home is I have 3 kids. They're 21, 18, and 13. And normally they're so involved in extracurricular activities, their schoolwork, friends, So having them home has actually been quite enjoyable. So even though it's a bit different than what it normally looks like, and it's difficult, I definitely think finding the silver lining in this is the time that you do get to spend with those that you care about.
I would agree. We've talked a lot about that too. And even if you think you're an introvert, you still need some of that personal connection. Yeah.
And I have amazing coworkers that are here in my office with me, and I miss them. I miss their smiles. I miss their laughs. You know, I miss the collaboration that we have together when, you know, we get our brains going. So definitely looking forward to the day when we can be back together in the office again.
Absolutely. I think we all feel that way. Well, thank you so much for taking a few minutes of your time today to chat with us and tell us what you are all doing at Boys and Girls Club. And thank you for all that you are doing to care for your children and your family. So we will chat with you again in the future.
All right. Thank you so much.
Thank you.
Talk to you later.